In the 19th century, medicine was a battlefield. Doctors battled an invisible enemy: tuberculosis, pneumonia, heart failure. These were mere guesses, death sentences, but not diagnoses. To understand anything, a doctor would press their ear to the patient's chest. This was uncomfortable, humiliating, and often pointless, especially when dealing with women. Then, in 1816, a young French physician named René Laennec encountered this very problem. A patient, obese, her heartbeat barely audible. Press an ear to her chest? Impossible. So he took a sheet of paper, rolled it into a tube, placed one end on her chest, the other to his ear. And he heard, clearly, distinctly. What had been an indiscernible murmur became music. This simple tube, a 30-centimeter long wooden cylinder, became the stethoscope. It was an instrument that allowed doctors to look inside a living body, to hear the heart's secrets, to recognize the lungs' whispers. What began as an improvisation transformed into the foundation of a new diagnostic era. This invention revolutionized medicine, giving it eyes where before there had only been blindness. But the history of scientific breakthroughs is rarely as clean as it's presented. It's not just a moment of epiphany, a flash of genius changing the world in one swoop. True discoveries are born not in the quiet of laboratories, but in chaos, in resistance, in the struggle for recognition. They are the result of stubbornness, doubt, and endless debate. Laennec's path was no exception. On the contrary, he faced ridicule, disbelief, and a fierce battle against centuries of established traditions, a fight for medicine to finally learn how to listen. For centuries, medicine relied not on knowledge, but on dogma. Doctors drew wisdom from ancient treatises written a millennium and a half earlier. Galen's theories, formulated in antiquity, remained unshakable, dictating everything from understanding the body to treatment methods. The human body was conceived as a collection of fluids, blood, phlegm, black and yellow bile. An imbalance of these humors was considered the cause of all diseases. Hence the barbaric methods: bloodletting to exhaustion, emetics, and bowel purges. The goal was to balance the body, but the result was most often exhaustion and death. Most patients did not recover. They simply died or survived, despite rather than because of medical efforts. Surgery was a field of torture. Operations were performed blindly, without anesthesia, on living flesh. Speed was a surgeon's only virtue. Open wounds were doused with boiling oil, believed to cleanse and cauterize. Patients' suffering was unbearable. Pus was considered laudable, its presence meaning the wound was healing correctly. Infections raged, and mortality was horrific. Doctors acted intuitively or by habit. A scientific approach did not exist. Diagnosis was based on external signs, not internal processes. Every breath, every heartbeat remained invisible, inaudible, incomprehensible. This was a world where authority mattered more than experience, where tradition stifled any attempts at change, and where anyone who dared to question faced a deaf wall of rejection. The body remained an impenetrable mystery. Medicine groped its way in utter darkness. It lacked light. It lacked a tool, something that would help look inside, hear hidden signals, understand causes, not just effects. It was a dead end that held medicine captive in ignorance for centuries. Into this world, where medicine remained enslaved by ancient dogmas, where every diagnosis was merely a guess and treatment a torture, came a man destined to break this vicious cycle. His name was René Laennec. He was born in 1781 in the small Breton town of Quimper. As a child, he lost his parents and was entrusted to the care of his uncle, who was a physician. It was this uncle, Gabriel Laennec, who became his first guide into the world of medicine, though this world was full of harsh realities. From a young age, young René saw how helpless doctors were in the face of diseases, how little they knew about what was happening inside the human body. His path into medicine led through Paris, a center of European thought, but also a center of unbearable suffering. He studied and worked in hospitals during an era when France was shaken by revolutions and wars. Lazarettos were overflowing. Injuries, epidemics, and diseases caused by poverty and unsanitary conditions decimated people by the thousands. Every day, René faced the powerlessness of medical art. He saw patients dying from diseases that could not be recognized. He saw colleagues diagnosing based on external symptoms, on smell, on skin color, but never on the actual processes within the body. Treatment methods based on ancient Galenical theories did more harm than good. Bloodletting weakened already emaciated patients. Emetics and laxatives led to complete exhaustion. Purulent wounds, considered a sign of good healing, were in reality breeding grounds for infections. Laennec was not just a student, not just a doctor. He was an observer. He did not blindly accept outdated dogmas. Every day, bending over the bodies of the sick, he felt deep frustration. He understood to help, one must not merely treat symptoms, but understand the cause. One must not guess, but see. Not assume, but hear. But how? The human ear was too unreliable, the eye too blind. The body remained a locked fortress that could neither be studied nor understood. He saw this dead end every day. He felt its weight, and in him grew the conviction medicine needed a new language, new eyes, and new ears. These new ears were not found in ancient treatises, but in a simple wooden tube. That first improvised stethoscope, which allowed Laennec to hear a barely discernible heartbeat, was not just a curiosity to him. He realized he held something more than a mere accident. It was a portal into the hidden world of the human body. And Laennec did not stop at this accidental insight. He took the next step, a step that would forever change medicine. Every day, bending over the bodies of patients in hospitals, he applied his wooden cylinder for hours, for days, for months. He listened, compared, recorded. He sought patterns in the chaos of sounds that no one before him had heard, no one had tried to understand. Rails, wheezes, thumps, murmurs, all of this was an alphabet to him. He learned to read the language of the body, which had been silent until then. This was exhausting, painstaking work. He didn't just hear noise, he tried to understand its source, its meaning. He heard how lungs affected by inflammation produced a unique crackling sound, similar to hair rubbed between fingers. Laennec named it crepitation. This was not just a sound, it was a clear, identifiable sign of pneumonia. Before him, diagnosis was based on cough, fever, pain, on external symptoms. Now he heard the disease from within. He could distinguish pneumonia from bronchitis, from tuberculosis. Each disease corresponded to its own unique sound pattern. He listened to the heart, heard its rhythm, and then anomalies. A murmur like the rustle of silk indicated valve problems. A dull, indistinct thump, fluid accumulation. Previously, doctors could only surmise based on pulse or skin color. Laennec heard the pathology. He didn't just invent an instrument, he created a new diagnostic system. He gave names to these sounds, created new terminology that allowed doctors to speak about internal processes, not just external manifestations. His stethoscope became a microscope for him, but for sound. He delved into a world hidden from everyone, a world where diseases left their sound imprints. And he was the first to learn to recognize, systematize, and understand them. He didn't just invent a tube, he proved that the body speaks. One just needs to learn to listen to it. This was the first confident step from a world of blind guesses to a world of accurate, confirmed diagnosis. It was the light that medicine had so long lacked, and this light began to dispel centuries of darkness. His stethoscope was merely a tool. The true breakthrough lay in how Laennec used it. He didn't just hear noise, he learned to read it. He didn't just listen, he listened, and then compared. He compared sounds heard in living patients with what he observed during autopsies. Every rail, every murmur received its anatomical confirmation. This was the empirical method in its purest form. He built his knowledge not on ancient texts, but on direct observation, on facts. This was science born from experience, not from dogmas. He didn't guess, he verified. Laennec did not stop at a chance insight. A paper tube? That was just the starting point. He experimented, made tubes from wood, of different lengths, different shapes, seeking the ideal acoustic solution. It was a constant search, improvement, refinement. He learned at every step. Every new patient was a lesson for him. He learned to recognize the finest nuances, to distinguish one sound from another, to understand what lay behind each sound. He transformed chance into a scientific method and a simple object into a precise instrument, an instrument that constantly evolved in his hands. But knowledge not transmitted to others is useless. Laennec understood this. He could not keep his discoveries to himself. In 1819 he published his work, De l'Auscultation Mediate. This was not just a medical treatise, it was a true revolution in knowledge transfer. Firstly, he wrote it in French, not in Latin, the language of scholars, accessible only to a select few. This opened doors for hundreds of doctors who did not know ancient languages, making his methods accessible to the wider medical community. Secondly, and no less importantly, he gave names to the sounds. He created entirely new terminology. Crepitation, rails, murmurs, pleural friction rub. These words became the alphabet for any doctor. He gave them a common language, a language in which one could speak about the invisible. He didn't just invent an instrument, he created a system that allowed doctors worldwide to speak the same language about internal processes, exchange accurate data, and learn from each other. What was his true genius? He combined several things. He trusted his senses, not authorities. He verified every one of his assumptions. He constantly improved his instrument and his method, and he shared his discoveries, creating a new scientific discipline. He was not just an inventor, he was the first true clinician in the modern sense of the word. A man who taught medicine to listen and understand, laying the foundations for the modern approach to diagnosis. His path showed that true progress is born not from blind adherence to tradition, but from a stubborn search for truth, confirmed by experience. Upon publishing his monumental work, Laennec did not receive universal acclaim. On the contrary, he faced fierce resistance. The world of medicine, built on the authority of ancient dogmas, was not ready to accept this new language, this new view of the body. The stethoscope, this simple wooden cylinder, became for many not a tool of salvation, but a symbol of threat, a threat to their established order. They called it a toy, a wooden whistle. Many doctors saw it as charlatanism, an attempt to replace true art with mere craft. How can one trust a piece of wood more than one's own senses? They questioned. A true doctor, in their opinion, should rely on intuition, experience, and direct touch. Applying a piece of wood to the body was considered indecent. It insulted the patient's dignity and demeaned the doctor himself, transforming him from a wise healer into a mechanic listening to noises. Doctors trained in Galen's theories could not understand why these new complex sounds were needed. Why complicate what was already understood? Diagnoses were made based on external symptoms, on the balance of humors. Sounds from within? This was too new, too alien. It went against everything they had been taught for centuries. Laennec was accused of diverting medicine from its true path, of trying to replace living art with dead mechanics. His methods were ignored during hospital rounds. Students attempting to use the stethoscope were ridiculed, advised not to bother with foolishness. Many professors refused to include auscultation in their courses, deeming it unnecessary and even harmful for students. But not everyone was blind, and not everyone clung to the past. A younger generation of doctors, weary of the helplessness of old methods and thousands of preventable deaths, saw hope in the stethoscope. They learned from Laennec, understanding that in his hands lay not just a tube, but a key to understanding disease. The patients themselves, whom Laennec diagnosed accurately, became his unwitting defenders. When he predicted the course of a disease or even death with frightening accuracy, and autopsies confirmed his every word, skepticism began to melt away, gradually, not immediately. Influential colleagues, such as Jean-Nicolas Corvisart, Laennec's teacher, could not completely ignore this breakthrough. Corvisart, himself a proponent of empirical methods and percussion auscultation, though not directly using the stethoscope, nevertheless, his authority and openness to new knowledge created a kind of shield for Laennec. He was not alone. He was believed by those who saw real, life-saving results, those who understood that medicine must move forward, not remain captive to outdated dogmas. The resistance was fierce, but Laennec did not retreat. His toy continued to speak, and it spoke with frightening accuracy. An invisible battle unfolded in hospital wards. The old guard of doctors, accustomed to guesswork, looked down on their young colleague, bent over a patient's chest with a wooden tube. They made their diagnoses imbalance of humors, bad air, weakening of vital forces, general phrases, no specifics. Laennec, after listening, described the disease with surgical precision. A crackling sound, like hair being rubbed, in the lower lobe of the right lung. Inflammation progressing to consolidation, or a murmur like the rustle of silk over the aortic valve, heart failure caused by narrowing. He didn't just name the disease, he indicated its location, its stage. He bolstered his confidence with one thing, frightening predictive power. He predicted outcomes with an accuracy that shocked even his fiercest critics. And then came the moment of truth. The patient died. This was inevitable in that era. But after death, an autopsy followed. And each time, almost without exception, the pathological report confirmed Laennec's words. Every crackle, every murmur, every thump heard through his wooden cylinder found its anatomical confirmation. Consolidation in the lung? It was there. Valve narrowing? It was visible to the naked eye. Pus in the pleural cavity? There it was. This repeated itself again and again, day after day, week after week. The accuracy of his diagnoses, confirmed by autopsies, became an irrefutable argument. The skepticism of the old school began to crumble under the weight of facts. Their dogmas, their intuition, their centuries-old wisdom proved powerless against a simple instrument and precise observation. One could not ignore what saved lives and explained death. One could not deny an instrument that allowed seeing what was hidden. Laennec transformed from an eccentric into a visionary. His lectures, initially ridiculed, began to attract crowds of students and young doctors. They eagerly absorbed every word, every sound description. They saw medicine emerge from the gloom of guesswork before their very eyes. He was appointed chief physician at one of the most prestigious Parisian clinics. His method, his terminology, his stethoscope, all became the cornerstone of new diagnostics. The invisible world inside the body was revealed. Medicine finally learned to listen and to understand. The stethoscope entered daily practice and became an essential attribute of a physician. In hospitals in Paris and then across Europe, auscultation became an integral part of every examination. Medical universities began restructuring their curricula. Students were no longer taught to rely solely on external signs and ancient dogmas. Now they listened for hours, learning to distinguish crepitation from rales, an aortic valve murmur from a mitral valve murmur. This knowledge changed treatment protocols. Whereas previously most feverish conditions were treated with bloodletting, doctors could now determine if the cause of the fever was pneumonia, tuberculosis, or heart failure. Specific approaches were developed for each of these diseases. Bloodletting, though not completely gone, was used significantly less often and with greater understanding. Barbaric purges and emetics used indiscriminately disappeared, replaced by more targeted measures. Most importantly, diagnostic accuracy began to save lives. While complete statistics from that era are lacking, historical data indicate a significant reduction in mortality from pulmonary diseases such as pneumonia and tuberculosis in clinics where Laennec's methods were actively applied. Doctors could now foresee the course of a disease, prevent complications, and intervene at early stages. Patients previously given vague diagnoses like exhaustion or bad air now received a concrete explanation of their condition and, more importantly, more adequate treatment. This new precision spurred the emergence of specialized fields of medicine, cardiology and pulmonology. These disciplines, studying specific organs and their pathologies, began to form precisely because of the ability to hear internal processes. Autopsies, which were once merely confirmation of death, now became an invaluable tool for education for correlating heard sounds with actual changes in organs. Medicine ceased to be an art of guesswork. It became a science based on measurable facts, on sounds that were previously silent. And this sound changed the world. This sound changed the world. But the story of René Laennec is not just a chronicle of the stethoscope's invention. It is a powerful reminder the greatest breakthroughs often lie in paradoxical simplicity. A man armed with a wooden tube challenged centuries of established beliefs. His genius lay not in creating a complex machine, but in the courage to hear what had previously been only an indistinct noise. He taught an entire science to trust its ears, not ancient treatises. He proved that the body speaks. And this language, deciphered through a humble cylinder, paved the way from blind guesswork to precise knowledge. Thus, through one man's stubbornness and his willingness to listen, a new reality was discovered, a reality that showed, sometimes, to understand the world and change it. One only needs to listen carefully to what seems invisible.